Hello everyone, this is Tamer Helmi with Quality Vigilance, and today I'm going to talk to you about designing compliance and why pharmaceutical facilities succeed or fail before the first batch. When we talk about pharmaceutical compliance, most people think about SOPs, training records, and batch documentation. But in reality, many of the most significant compliance risks are literally built into the facility. In pharmaceuticals, facilities are not just infrastructure. They are controlled systems. HVAC design determines contamination risks. Material and personnel flow determine whether segregation is theoretical or real. Utility design determines whether systems are robust or fragile. Regulators expect facilities to support product protection, enable operator compliance, and prevent human error, not rely on heroics. A well-designed facility makes the right way the easy way. On the other hand, a poorly designed one guarantees recurring deviations, CAPAs, and inspection observations. Design choices that directly impact GMP outcomes. Let's break this down into three practical areas inspectors care about. First, flow and segregation. Poorly designed flows lead to cross-contamination risk, line clearance failures, and confusing personnel practices. While on the other hand, effective design clearly separates raw materials, intermediates, and finished products. Clean and dirty operations, people and materials. If you need signs and SOPs to explain the flow, the design has already failed. Second, cleanability and maintainability. Regulators often ask, can this be cleaned and can it be maintained without breaking GMP? Good question. So the design pitfalls include inaccessible piping, poorly sloped floors, equipment placed too close to the walls, or utilities routed through classified areas unnecessarily. These issues don't just cause maintenance headaches, they drive deviations and inspection findings. Third, utilities and environmental control. HVAC, water systems, and gases are among the most cited inspection topics. Design must support stable, controllable environments, clear monitoring points, alarm rationalization, ease of qualification and requalification. If your facility requires constant intervention to stay in spec, inspectors will notice. Next, compliance is cheaper at the design stage. One of the biggest misconceptions in pharma is that compliance can be fixed later. And let me tell you, retrofitting compliance is exponentially more expensive than designing it from the start. Late stage fixes often result in compromised workarounds, overly complex procedures, increased operator dependency, and permanent regulatory risk. While as expected, good design reduces training burden, investigation frequency, inspection stress, and quite honestly, long-term operating cost. In other words, good design is a business decision, not just a quality one. Let's talk about what inspectors really see. When regulators walk into a facility, they immediately stress, does this site really understand contamination control? Does the design reflect process knowledge? And lastly, is quality embedded in or layered on top? Facilities tell a story. A well-designed site signals control, maturity, and leadership commitment to quality often before a single document is reviewed. In the end, if there is one takeaway, it's this. Facilities don't just house GMP operations, they enforce them. Compliance is not something you operate into a building, it must be engineered into it. In pharmaceuticals, strong quality systems start with strong facility design. Get the design right and compliance follows. Get it wrong and you'll spend the life of the facility trying to compensate. Thank you everyone for following. I hope you got value of this video. Please subscribe and request for other videos if you like. And I'm happy to speak to you in another video really soon. Hello everyone. This is Tamer Helmi. If you like the content of this channel, please consider subscribing, liking, commenting, and supporting the channel.